Good afternoon, everybody. Welcome to today's online presentation, Improving the Data Landscape on IEHPs, Recent Data on IENs Not Working as Nurses in Ontario. Before we begin today's presentation, I would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory, and the peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples, and their valuable past and present contributions to this land as well. My name is Andrew Tomeyer. I'm N4's Education Coordinator. I will be hosting and moderating today's presentation. I'm here with my colleague and co-host Colleen Drake, N4's Project Engagement Coordinator, who will be monitoring the Q&A box today. I'm now very pleased to introduce to you today's presenters. I'm going to ask that you turn on your video as I introduce you. Joan Atlin is Director of Strategy, Policy, and Research at World Education Services. Joan has over 25 years of experience leading and executing strategic policy, advocacy, and program initiatives. She has worked extensively to improve access to professional registration and workplace inclusion of internationally trained professionals. Past roles have included Director of Programs for the Toronto Region Immigrant Employment Council and Executive Director for an Ontario Association of Internationally Trained Doctors. Joan has also developed and managed bridging programs and served as senior program and policy advisor in the former Ontario Ministry of Citizenship and Immigration. Welcome. Paolo Varias is a registered nurse who is currently serving as Associate Director of Clinical and Support Services for Niagara Region in Southern Ontario. He holds a Bachelor of Science in Nursing from the Philippines and a Master of Science in Aging and Health from Queen's University. He is currently pursuing McGill University's International Masters for Health Leadership. He has studied the impact of universal healthcare programs and contributed to an international USAID project before becoming Associate Director. Paolo has held several leadership positions in long-term care facilities. In 2014, he immigrated to Canada and began the process of becoming a licensed nurse. He received his registration from the College of Nurses of Ontario in 2016 as well. Paolo is a passionate healthcare advocate committed to challenging systemic barriers facing internationally educated healthcare professionals today. Thank you. Today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with details for an alternate makeup session. As well, before we start, we always like to provide housekeeping with regards to our Q&A. We'd like to take a moment to introduce you to the Q&A feature, and you have the option of upvoting a question if you have similar questions posted to the Q&A. So please upvote questions you're interested in hearing the answer to, and we'll prioritize which questions we pose to the speakers first. Our presenters today do not have any conflicts of interest to declare. So with that said, let's jump right into today's presentation. I will pass the virtual lectern over to Joan. Take it away.
Thank you so much, Andrew. Thank you to N4 for the opportunity to present with you today and to share the results of the West Survey of IENs not working as nurses in Ontario. Thank you to Paolo for taking the time to offer his reflections this afternoon on the survey and the report. And I also just want to mention that my colleague, our research manager, Marlena Flick, who did the data work on this study, is also here with us behind the scenes and available to help answer questions later. And as well, just a shout out to my colleague, Caroline Ewan, Manager for Policy and Advocacy, who was the other author of this study and who's now off on mat leave. And of course, thank you to everyone who's participating and who's joined us on the webinar this afternoon. In terms of the agenda that we're going to walk through, we'll start out by just talking a little bit about the background of data, what is and isn't available, what we do and don't know about IEHPs based on available data, and some context for why we undertook this study. Then I'll speak to the findings of the study itself, speak to some of the policy implications of those findings, and then I'll pass it off to Paolo to share his perspective and reflections as an IEN, as a healthcare leader, and as an employer. And then we should have some time left for questions after that. So before I jump in, I just want to briefly introduce World Education Services. Those of you who are familiar with WES probably know us best as, and primarily as an academic equivalency assessment body. And that is the core of what we do as a social enterprise. We're one of 5 academic credential assessment services who are accredited by IRCC to do assessments for immigration purposes, and we do about 80% of those for economic streams in Canada. We also work with some regulators to provide academic equivalency assessments for licensure purposes, as well as to international students for education purposes. However, our broad mission is to support the economic, social, and educational inclusion of immigrants, refugees, and international students. And so to that end, we're also actively engaged in shaping policy, in collaborating on the design of programs, providing philanthropic support. And we work across a range and a diverse set of organizations and partners and networks to uplift individuals and to drive systems change. And so this work in the realm of internationally educated health professionals is very much part of that work. So now let's move on to some background and context for why we did this study. There's so many fundamental unanswered questions that aren't adequately answered by the existing data on IEHPs in general and on IENs more particularly. First of all, how many IEHPs are there in Canada? That's not a question easily answered. How many IENs are there in Ontario? Where are these individuals in their journey towards registration and in their employment journeys? What proportion of them are already licensed and working as nurses? That one is easier to answer. How many are licensed and working as nurses? We can answer, but what proportion of the broad number? We don't know. What proportion have applied for licensure? What proportion haven't even begun that process but would like to? Are those not licensed yet using some of their skills in their current jobs? And are the recent initiatives, and there have been many across Canada and in Ontario, are they reaching all of those who could benefit from them? And what proportion of IEHPs are potentially still being left behind? So why can't we answer these questions? As you can see on this slide, there's a huge variety of organizations that collect some data on IEHPs in general and IENs specifically at various points in their journey, but there's no one organization that is responsible for tying all of this fragmented information together or filling in the gaps of missing data. IRCC does have what they call field of study data for those who apply through economic immigration streams, so we know what people studied, as well for those landing as permanent residents through the economic stream. They are asked what their intended occupation in Canada is. However, we've been told by StatsCan themselves that this data is actually very incomplete, and a lot of the intended occupation data is missing. And for those who enter through special streams, like for instance, the caregiver stream, they're not asked for this information. If you're coming as a caregiver, it's assumed your intended occupation is caregiver. And we know, of course, that a very large portion of those who come in under the caregiver stream are in fact PSW, are in fact nurses, ANs. And of course, previous field of study and intended occupation is not something that's captured for those who enter on temporary visas as workers or as students. And we know that increasingly we've heard stories of IENs coming as students to join Canadian programs so that they come out with a Canadian credential. So overall, the data that IRCC collects doesn't give a complete picture of IHPs entering the country, and so they can't answer the question, how many are there in the country? Our regulatory bodies, of course, have data on those who've applied for licensure or who've been licensed, but not on those who haven't yet applied, of course. That data tends to sit more with service providers, bridging programs, navigation services, like, for instance, the Care Centre for IENs in Ontario or the Health Match in BC. Those providers will have data on those who've accessed their services, but no one has the complete picture. So since West began actively engaging on IEHP issues at the beginning of the pandemic, we and a number of other stakeholders, a group of healthcare associations that we've been working with and healthcare unions, started to wonder how we could contribute to filling some of these data gaps. And we started to envision a study. Initially, we were thinking nationally, but as we dug in, we decided that it would make the most sense to try to narrow in on either nursing or medicine, and we were particularly interested in nursing on this issue, and in one province, and to try to do this and take an approach that could potentially be replicated in other provinces and professions. So we settled on nursing in Ontario, given the close working relationships that we have in Ontario, and the sheer number of IENs in Ontario, and the number of initiatives targeting IENs since the pandemic began. There have been a large number of initiatives aimed at facilitating IEN registration across the country, and these initiatives taken together have begun to show real impact in advancing IEN registration. Wes has been tracking these initiatives, and the link that you see at the top of the slide, that provincial scan is available on our website, and we'll share out these slides after the session. This slide shows just the initiatives that have emerged in Ontario alone since the pandemic, which have led to a very significant rise in the number of IENs registered through CNO in the last couple of years. But the launch of all of these initiatives makes it even more important to have an accurate picture of how many IENs are in the province and where they're at in their journeys, so that we can tell what proportion are being reached by these initiatives. So let's turn to what we know and don't know from the existing data about IENs in Ontario. First of all, in terms of what we know about how many IENs are in Ontario, according to 2023 CNO data, about 15% of all registered nurses in Ontario obtained their training abroad. And that includes the United States, of course. As of January 2024, we know that, again, through CNO data, 61% of all active applicants to the CNO for registration are, in fact, IENs, and that's almost 8,000. At the same time, and this shows where some of the confusing discrepancies and incomplete data come in, at the same time, IRCC data from 2020 to 2023 show that only just over 1,400 new permanent residents to Ontario declared their intended occupation as RN or RPN. So while, of course, many of the applicants to CNO may have arrived before 2020, these kinds of discrepancies really show how hard it is to get an accurate picture and how inaccurate our current picture is of just how many there are. In terms of what we know about what proportion of IENs are working as nurses, there are some stats from a StatsCan study from 2020 on the underutilization of IEHPs that showed that only 37% of those who have a bachelor's degree or higher in nursing obtained internationally were working in their field. And that's compared to 78% of those with a nursing degree, a domestic nursing degree. And at the same time, 25% of recent immigrants who are working as nurses' aides, orderlies, and patient service associates hold at least a bachelor's degree. And of those, almost 70% have a nursing degree. So all this gives us a really good sense of the level of underutilization. What the data doesn't tell us, once again, for IENs in the province are, we can't know because we don't have the total number. We don't know what proportion of that total are seeking to re-enter practice in Ontario, and how many of those are being reached by these recent initiatives. What proportion haven't even begun the registration process or may be struggling with barriers to even beginning or to the process, and really how many are underutilized. We don't have an accurate count of how many IENs are underutilized or underemployed in the labor market, and who they are that would help us understand how to best connect with and support them. So these are the kinds of questions that we sought to try to address with this very preliminary attempt with the survey that we did of IENs not working as nurses in the province. So I'll move on now to describing our survey, the findings, and some of the implications. And I just want to mention that in addition to the survey, we did follow-up interviews with a small number of IENs who responded and agreed to be interviewed. And so throughout the presentation, I'm going to share a couple of quotes from IENs who'd responded to the survey that illustrates some of the findings. In terms of the goals, I won't speak to those. I think we've made those pretty clear. We used a snowball sampling method. We distributed the survey to WES applicants who had nursing degrees and through a network of partners, including the Ontario Long-Term Care Association, Ontario Hospital Association, VHA, the Care Center for IENs, SEIU, N4 helped us to publicize the survey. So we had a large number of responses. We had almost 2,000 responses. And once we narrowed that to those who are not working as nurses, who are in Ontario and who completed, enough of the survey for a valid response, we had over 750 responses. And just to flag that we are aware that there are some possible skews in our sample because of who our distribution partners primarily were. And that's that our sample may be skewed towards IENs who are already working in some role in the health sector, probably certainly skewed towards Anglophone respondents. We did have the survey available in French, but we had a very small number of respondents. And as well, probably a skew towards urban centers. So looking now at the data itself, and starting with countries of training, you can see that from our survey respondents, 65% of our respondents trained in either India or the Philippines, more in our response from the Philippines. We looked at the CNO data on registered IENs to see how comparable our sample, roughly speaking, was. And you can see that it's obviously quite comparable in terms of the top two countries of training. The proportions are somewhat different between India and the Philippines, but when you add those two groups together, 65% in our sample, 67% in the CNO registration data. However, when you look at the top 10 source countries, you see in the WES survey data that Brazil, Nigeria, Saudi Arabia, Uganda, Hong Kong all appear in the top 10, but those do not appear in the top 10 countries of IENs licensed with the CNO. And this really suggests that IENs from these countries and others are probably less likely to be pursuing registration immediately, and they are likely to be facing a number of other additional and unique barriers to even beginning the application process. So it would be really important to consider policy and programmatic interventions directed at IENs who've trained in these countries who aren't ultimately making it through the licensure process. This next slide looks at place of residence of the respondents. As you can see, the majority reside in the GTA. In terms of the distribution, these findings align closely with the 2022 analysis of regional distribution of registered IENs in Ontario, which showed that 80% of IENs who were practicing were in just 6 of the 14 LHINs across the province. And you can see in our findings as well that only 3% were living in rural regions. And these findings, of course, are unsurprising and in line with general immigration trends in terms of where new immigrants tend to settle, and in terms of the challenges of recruiting and retaining healthcare professionals in rural and remote regions. The next slide speaks to the registration status and the registration intentions of the respondents. This is probably the most important finding in the survey, and that is that only 38% of those who responded to our survey had applied yet to CNO for registration. Fully half, nearly 380, had not even begun the application process, and a further 6% didn't intend to apply. So the largest number of our sample who hadn't even begun the application process is really striking. And while we can't know for sure, of course, we can hypothesize from this number that the number of IENs in Ontario who could potentially join the nursing workforce is significantly undercounted by other official data sources and may in fact be quite large. So as I mentioned, we interviewed several respondents, and here's the voice of an IEN who is not planning to apply, who said, "If I had the choice to return to nursing, I would not work as a regular duty registered nurse. Maybe I would go into a more administrative or technical role based on my experience in health informatics, risk management, quality assurance. But I don't want to repeat the process to qualify. The process is lengthy, and I don't think it's worth it, especially when I compare the income I would make in nursing as compared to another career. It's not worth it." So this slide looks at the employment status of IENs. We asked if they were employed, whether they were employed in the healthcare sector or outside of it, and if they were working full or part-time. As you can see, the large majority were employed, 78%. And of those, 61% were in fact working full-time. Of those not in the labor force, i.e. those who were not seeking work, which was a fairly small group of respondents, only 45. The largest group were pursuing higher education, and the next largest group actually didn't have work authorization in Canada. In terms of sector, the vast majority, almost 80%, were working somewhere in the healthcare sector in some kind of health-related role. The other 21% were working outside of the healthcare sector, so 1 in 5 of our respondents. And as I said, our sample is likely skewed towards those working in the healthcare sector. But we can see the distribution, people working in manufacturing, factory work, warehouse work, childcare and caregiving, not surprisingly, administration, food services, maintenance and cleaning services. So here's another respondent quote. And these few simple sentences really capture a range of issues. This respondent said, "I arrived in 2019 as a visitor. Then there was a delay in late 2021, at which point I wasn't able to extend my visitor visa and I didn't have status at that time. I got my work permit in 2022 through the caregiver stream. I'm still working as a nanny now." So this really points to the fact that IRCC wouldn't even have captured the fact that this caregiver in the country since 2019 is in fact a nurse. She's not using her nursing skills. She's been here long enough to have lost her recency of practice. And she's doing work that likely contributes to both financial and time barriers to being able to move forward towards licensure. So let's look at full-time versus part-time work. We wanted to those who were working outside of the healthcare sector were considerably more likely to be working full-time. Among those working in healthcare, more than a third were only working part-time. And we can speculate that many of this group were likely willing and able to work full-time and were underemployed. So this really reflects and makes us think about the kinds of roles that IENs are working in the healthcare sector, typically in roles like PSW, patient assistant, dietary assistant, etc. And the working conditions and the employment conditions in those roles. As part-time work tends to generate lower income than full-time work, it may be, I'm sorry, I have iPads, you've just arrived. Same. Oh, geez. As part-time work tends to generate lower income than full-time work, that may well contribute to why we're going to see shortly that finances is such a prominent barrier to IEN registration. So it's crucially important that we consider the relationship between part-time employment in the health sector, financial precarity, and the kinds of supports and interventions that could help move more IENs back into nursing practice in the province. So if we look at how much we asked respondents to what extent their current jobs make use of their nursing skills and experience. So I know it's a bit hard to see the colors. The light blue is not at all, the darker blue is some, the light green is a lot, and the dark green uses all of my nursing skills and experience. So unsurprisingly, almost all of the IENs working outside of the healthcare sector, so the blue shaded bars, reported that their jobs make use of none or only some of their skills and experience. And this clearly demonstrates the de-skilling of IENs who end up working completely outside of healthcare. Of those working in healthcare, 1/3, the two green sections on the left, responded that they're using a lot of their nursing skills, and almost 2/3 reported that their job makes use of some of their nursing skills. And 7% are not using any of their skills at all. So if we look at the total of those working both in the healthcare sector and not, almost 1 in 5 respondents indicated that their jobs don't use any of their nursing skills and experience. So we asked respondents about the factors affecting their journey towards registration, and we were careful to use the language of factors, not barriers, because there are a mix of types of factors, and some, of course, are required elements for licensure, though IENs may, of course, face barriers in meeting those requirements. Financial reasons, as you can see, appeared as the top factor influencing registration across categories of respondents. And this reflects the issues that we were just discussing and suggests that we really need to pay attention to financial barriers, both for IENs who are in the application process and may have costs to pay, do have costs to pay in that process, but also for those IENs who don't have the financial resources to even begin the journey. The recent initiatives by Health Force Ontario to reimburse IENs for registration costs and exam fees addresses important aspects of this financial barrier. And in British Columbia recently, the province announced that it would cover nursing application and assessment fees upfront. Covering fees directly and upfront is a best practice that should be considered in all provinces. Of IENs who had already applied for registration, 25% still needed to write the registration exam, and 17% needed to meet the educational requirement. The number that's close to 1 in 5 of those who still need to meet the education requirement is an important factor in light of the recent proposal by the College of Nurses of Ontario to recognize nursing degrees from other jurisdictions. Amending that requirement itself could facilitate registration, according to our response data, for as many as 1 in 5 IENs who are interested in pursuing registration. And for those IENs who don't intend to apply, the length of the process, the complexity were key factors that they cited. So here's another quote from a respondent. I think that Canada has to streamline the evaluation process. A more comprehensive orientation program for internationally trained nurses would be good too. I understand the importance of a comprehensive evaluation to ensure the quality of nursing, but I think it's important to reach a balance between maintaining standards and minimizing evaluation time so that we can contribute our skills and expertise in the new environment sooner. So I want to talk about some of the implications of our findings. And I want to focus in on 6 areas in particular where we really need to continue to seek solutions to ensure that all qualified IENs are able to return to their profession. First is that this study corroborates other studies showing the persistence of skill underutilization for IENs in Ontario. And the fact that over 50% of our respondents had not yet begun the registration process, although they intend to. And then this means, as I said before, that there may be really significant numbers of IENs in the province who aren't accounted for in official databases and whose nursing skills and experience are going unrecognized and underutilized. So ongoing collaboration between all the system stakeholders, government, regulatory bodies, employers, healthcare employers in particular, IENs themselves, post-secondary institutions, the community-based organizations that serve IENs. This ongoing communication is absolutely essential to continuing to make meaningful progress on this issue. Secondly, the study shows that while a small proportion of IENs were working outside the healthcare sector or don't have the intention to return to nursing, the majority were either actively pursuing registration or planning to do so in order to return to their careers. And many of them are working in the healthcare sector in non-nursing roles. And this really underscores the critical role of health sector employers in identifying the IENs and other IEHPs in their organizations who are already working and who could really benefit from targeted supports to pursue registration and bridge back to their careers. For instance, I know that at Sunnybrook over the last couple of years, they have been actively asking IEHPs who work at the hospital outside of their fields to identify themselves so that the hospital can build supports around them and help them to navigate the supports and licensure process and move back to their professions. Thirdly, an increasing number of IEHPs are being invited to immigrate through provincial nominee programs in categories specific to, calls for nominees specifically in healthcare, as well as category-based selection for healthcare workers through the federal express entry program. So these are healthcare workers that our system knows are arriving. They're coming through specific category-based calls for healthcare workers. So this makes it all the more urgent that the system and system stakeholders find the proactive ways to ensure that these IENs and other regulated health professionals are caught right as they come in and directly and quickly connected to accreditation and licensing bodies and to all of the supports and services that are available to them. Fourth, we know that finances continue to be the most reported barrier by IENs. So we need to think more holistically about ways to provide strong financial supports and about the opportunities for IENs not yet working as nurses to earn adequate income that will allow them to take the steps they need to return to nursing practice. The study's also shown that there continues to be a need to reduce complexity and to support better navigation for IENs. IENs continue to cite complexity as a disincentive to pursuing registration. And lastly, at present, Canada and the provinces and territories continue to lack comprehensive workforce status strategies that include an accurate count of IEHPs and IENs entering the country, both as temporary and as permanent residents. Coordinated health workforce status strategies, including those being led by the Canadian Health Workforce Network, Canadian Institute for Health Information, and Health Workforce Canada, must ensure that IEHPs are accurately counted so that they can be included in planning for Canada's health workforce. And I want to end just on the fact that Canada is committed to upholding the principles of ethical recruitment outlined in the World Health Organization Global Code of Practice on International Recruitment of Health Personnel. The code addresses four key things: principles and practices for ethical recruitment of international health personnel, taking into account the rights, obligations, and expectations of source countries, destination countries, and migrant health personnel. Secondly, it looks at establishing or improving the legal and institutional frameworks for international recruitment, formulation of bilateral agreements and other legal instruments, and lastly, advancing cooperation on ethical recruitment as part of strengthening health systems with a particular focus on the situation in developing countries. So whether healthcare professionals are directly recruited by Canadian provinces and employers, or whether they pursue immigration on their own, seeking new opportunities, allowing this healthcare talent to become de-skilled, remain underutilized, and ultimately lost to the global healthcare workforce is ultimately an ethical failure. And it's one that we need to continue to struggle to find solutions for. So with that, I'd like to pass the floor over to my colleague Paolo Varias, Associate Director for Clinical and Support Services with the Niagara Region and an IEN himself, to share his reflections. Over to Paolo.
Thank you, Joan. So Reflecting on the journey of internationally educated nurses in Ontario is a profound exploration of dedication, resilience, and adaptation. So, over the past decade, Ontario has seen an influx of IENs drawn by the promise of opportunities and the chance to contribute to the healthcare landscape of one of Canada's most populous provinces. So, yet, behind each success story lies a tapestry of challenges, triumphs, and personal growth. I want to start by congratulating and thanking Wes for this work. This survey is really a reflection of what I see, what I hear every day, every time that I'm in the workplace. The survey validated that there are still gaps and more work is required to support internationally educated nurses as they transition, as they work on their registration to become nurses here in Canada. And thank you for providing a voice for the many IENs across the country and giving them a space to share their stories through the survey. Financial barriers, as an example, which was one of the significant findings of this survey, are issues of IENs, not just today, but even 10 years ago when I started my journey to become an RN here in Canada. It is very expensive. And the initiatives, even up until today, are very much focused on latter stages of the registration process. We have to rethink on how to support IENs at the beginning of their journeys so that they are not fearful on embarking to this journey of becoming an RN in Canada. I think we also need to look at how we could also actually provide support as well to the employers so that they can participate in programs wherein it supports the transition and integration of internationally educated nurses in Canada. The journey typically begins with the decision to leave one's home country, often fueled by a desire for professional advancement, economic stability, or simply the pursuit of a better life. This is the story of every IENs that I know. This is also my story. This decision is not made lightly. It involves leaving behind familiar surroundings, loved ones, and established careers. However, the allure of Ontario's healthcare system, renowned for its quality and inclusivity, beacons IENs to embark on a journey of uncertainty and possibility. On arrival, the reality of navigating a new healthcare system, cultural norms, and professional standards sets in. Language barriers, differences in medical practices, and bureaucratic hurdles present formidable obstacles that must be overcome, especially the financial barrier. Many IENs find themselves enrolled in bridging programs designed to help them adapt to the healthcare context and prepare for licensure exams. These programs demand rigorous study, clinical practice, and perseverance, often stretching IENs beyond their comfort zones. The licensure process itself can be a daunting ordeal, requiring candidates to demonstrate proficiency in clinical skills, communication, and critical thinking, and success is not guaranteed. And many IENs face the heartbreak of initial failure, forcing them to regroup, reassess, and try again. Yet, for those who persevere, the moment of receiving their nursing license is a triumph of determination and dedication. However, licensure is just the beginning. Integrating into the workforce as a newly licensed nurse brings its own set of challenges, and IENs may encounter skepticism from colleagues, skepticism rooted in cultural differences, or misconceptions about the quality of international education. Building trust, credibility, and rapport with patients and colleagues alike requires patience, humility, and a willingness to learn to adapt. Yet, amidst the struggles and setbacks, there are moments of profound growth and connection. IENs bring a wealth of diverse experiences, perspectives, and skills to Ontario's healthcare system, enriching it immeasurably. They forge bonds with patients from all walks of life, bridging cultural divides and fostering understanding and empathy. They inspire their colleagues with their resilience, resourcefulness, and unwavering commitment to compassionate care. And as time passes, IENs find their footing. carving out their place in Ontario's healthcare landscape, they may choose to pursue further education, specialize in a particular field, or become mentors and advocates for fellow IENs. Their journey, including my journey, is a testament to the transformative power of perseverance, adaptability, and the human spirit. In conclusion, the journey of internationally educated nurses in Ontario is a multifaceted tapestry of challenges, triumphs, and personal growth. This survey has allowed us to really see and provide us a clear evidence of what is really happening on the ground, what is really happening with the IENs. And I want to say thank you to Wes for this work. And thank you for giving me as well the opportunity to share my journey and the journey of many IENs that I am aware of. Thank you.
Thank you, Paolo. And thank you so much, Joan and Marlena, for the presentation as well. And to jump into our Q&A portion of the webinar, one question came up with regards to, did the survey capture data on how long the IENs have been in Canada?
No, in fact, it didn't. And that's a very valid critique of the survey. That is, in our overzealous efforts to keep the survey as short as we possibly could, we didn't, in fact, ask that question. And so I understand from the asker of the question that, of course, how long someone has been in the country certainly may impact whether or not they've begun the application process with CNO. However, I still think that if we were doing a better job of ensuring that as soon as IENs entered the country, and if we know they're here, that if we were doing a better job of ensuring that they get connected right away to the supports, to the services, and to the application process, and if they were able to complete initial assessments abroad before they arrive, then I think we would expect to see that number be much lower, even for those who are very recently arrived. Paolo, I don't know if you have anything you'd want to add to that.
Okay, thank you. The next question we have is, from the results of the survey, what sort of measures can be taken to help IENs return to practice quickly so they don't feel the urge to leave?
And this, I'm sure Paolo will have things to say on this. I do want to flag that there have been some really important initiatives taken in the last couple of years. The College of Nurses has undertaken a major modernization process of their entry to practice. And one really important initiative is the Supervised Practice Experience Program, Partnership Program, which is funded by the Ontario government and administered along with the CNO, which provides funding for healthcare employers to hire IENs who've been identified in the CNO database. So again, those who are already in the application databases of CNO, who are missing, who've met some of the other requirements, but are missing the hours of recent practice that they require. So practice within the last 3 years. And may also be missing their language requirement. And so this program funds employers, primarily in hospitals, but also to some lesser degree in long-term care, to hire on IENs under supervision and allow them to meet that recent practice requirement and allow their employer to attest to their ability to function in English. And that has brought a really significant jump in the number of IENs that CNO has been able to register in the last couple of years since that program came online. The funding that the funding reimbursement that the ministry, that Health Force Ontario is offering for IENs for exams and other preparation costs is also an important advance. The supports that are offered through the Care Center for IENs are really important supports to IENs. I think, one of the real missing pieces, though, as we flagged, is, there are, when we saw in the top countries of origin, there are a number of countries where you see, significant numbers of IENs, but they're not appearing in the registration statistics of CNO. So what's happening to the nurses from those jurisdictions? how do we create programs and outreach specifically to those communities where we know we can see that IENs are not advancing through the process. So that's one important piece of it. And as I said, really ensuring that when we have better data so that we actually could tell you how many IENs there are in the province and in the country, because no one can right now. And that we make sure that we are able to connect those IENs to the application process and to all of the supports that they need to make their way through it, including financial supports.
I'm going to jump in. So I think another important piece is that, you know, on the part of the employers as well, it's important to really identify who among your employees are internationally educated nurses and really understand, are they currently underutilized? Are they working as an RN or not? Especially if they have been educated with a bachelor's of science in nursing or they have a degree in nursing. I think we need to identify them so that we can identify what kind of support that they need. Sometimes I found that in my experience working as a healthcare leader is that IENs sometimes tend to be quiet in terms of asking for support or asking what they need. So I think we need to be more proactive. I think we need to, you know, within your organizations is really create opportunities to find out where and who they are and understand what they need. And if you know what they need is what assess as well if your organization could provide that support. Similar to what Joan was saying earlier, are you actually providing opportunities for them to be integrated, such as the Supervised Practice Experience Partnership Program? Is there an integration program that allows IENs in your organization to actually be part of so that they can actually be integrated in the workplace? Because that's very, very important. And another, I think, opportunity is really figuring out what kind of like transitional program you can provide for them as soon as they're in the workplace, because it's an opportunity as well for retention. I found that when it comes to IENs, the transition for them in the workplace is more challenging when it comes to really immersing themselves when it comes to the new culture. It's not about the clinical aspect of the work, but it's about really integrating themselves in the workplace, adjusting to the culture, adjusting to the language and other things. We need to come up with programs that are actually catered to support them, especially during their orientation, so that they don't get really overwhelmed as soon as they start and step on the floor wherein they are already working as nurses, and yet they are not really prepared to really understand that this is the culture of the workplace. This is the culture of healthcare when it here in Ontario as an example. So I think these are some of the things that we need to think about. Thank you.
Thank you, Paolo. And to plug our N4 St. Paul University IEHP program, we will be opening up pre-registrations for those who want to better understand the culture, the Canadian context, and that within the healthcare system. So thank you for the segue, Paolo. One question that we have, kind of a combination. Can you speak further on what employers can do to support IENs not practicing as nurses? And as well, do you or any of your partners have any strategies to help educate employers about identifying and supporting IHPs on their journey?
I can start. So one of the things is that I think employers need to really be knowledgeable when it comes to what are the programs available right now within the province or within our community. So what types of supports are available? So whether it's reimbursement programs through Healthforce Ontario, whether it's free sessions when it comes to the joining, understanding the registration process in Canada through HFO as well. These are important knowledge that I think employers need to know, and maybe creating a package for your IENs wherein they could access the website. And these are some of the tips. These are some of the information that would be helpful for them if they are embarking on the journey of becoming an RN in Canada. I think another piece is that maybe within your human resources in your organization is you have a point person who can hold, let's say, a monthly session in terms of providing like overview in terms of the registration process in here in Ontario as an example, because I found that with IENs and going to the website of the college, while it's a step-by-step process, it still feels very overwhelming for any IENs that I've spoke with. Even when I reflect on my experience years ago when I started my journey, looking at the website, and the website is telling you these are the things that you're going to be doing, but there are many steps, and it's hard because you cannot ask the website. But when you have someone maybe within your organization who will be able to explain it, really provide details, provide examples, provide people who could probably you can connect with, or people who has went through the process who might be able to provide feedback to that particular employee, those are, I think, great steps that would provide support. I think for IENs, it's always important that they have someone within the organization that they can actually ask, or even they can um, call, because it's very challenging when you are navigating a very complex process and you don't have anyone that you can ask to. And like what I was saying earlier, IENs tend to be quiet sometimes in terms of like what they are going through, and they don't wanna they don't want to ask people sometimes because they feel like it's a hassle for people when they are asking a question. So it would be great if we are more proactive in terms of giving them opportunities, that these are opportunities available for you and these are the things that we can help you.
Okay, I could just add there that we went on really an interesting journey, I think, at WES as we began to engage on this issue right at the beginning of the pandemic with the long-term care sector, with the Ontario Long-Term Care Association and Advantage Ontario and the Ontario Hospital Association, really working with those employer associations. Initially, they were just interested in connecting with the settlement sector and the employment services sector to recruit because of the desperate shortages for PSWs. But it allowed us to really begin a conversation to say, and they wanted to recruit among internationally educated health professionals. And it allowed us to really begin a conversation with those employer associations about what role they could play in helping to support the employers in their networks and the IENs to move forward. So that there, and more recently we met with the committee of Ontario hospitals who are supporting participating in the supervised practice experience program and supporting the IENs through that program. And they all flagged that they don't always know as employers what supports are available, what resources are available to IENs, and how important it is to them that the same, that information from government, from the College of Nurses, from the support programs for and support resources for IENs get to them as employers, and not to the CEO of the hospital who might be on the mailing list, but gets to the nursing leads in the hospitals so that they're able to effectively pass that information on to IENs.
Thank you. That sounds like an incredible journey with sharing this information and being able to help with the licensure process along the way. One question, actually, we have a few that are related to the study itself. Is there consideration for further depth, further analysis into the data that's been collected? Just to kind of summarize the three big questions about the survey development itself, or the data analysis itself.
Yeah, I do see one question there about whether we could cross-tabulate the data on country of study with registration status and where people are in terms of whether they've applied it or are intending to. We are able to do that. We can do that, and we can have a look at that and share that information back out through N4. Looks like Marlena wants to comment on that. We have our research manager here with us. Marlena, please do.
Great.
Hi, everyone. Happy to answer that question. We did actually make those crosstabs on country of origin because the numbers below, the numbers for applicants who came from countries other than India or Philippines were below 3%. The numbers are too small to draw any meaningful results, but I'm curious that there may be broader patterns outside of our survey.
Thank you. And to add to that, with the mentioning of how BC's got a program to help finance IENs in their licensure process, was there a review of IENs that moved out of Ontario to elsewhere in Canada?
Again, Marlena may want to comment on this, but we basically screened the first screening questions of the survey because we really wanted to focus in on IENs who were living in Ontario and not working as nurses. We screened out those who answered no to either of those questions. We do have some data on those who were registered in another province and also in Ontario. We were curious to see whether we could garner anything in terms of, you know, the as of right Ontario legislation of IENs being able to bring registration from other provinces. We had, you know, very small numbers there. But there are a few other questions in the chat about what we might be able to disaggregate, and we will have a look at those. We didn't ask about status, for instance, of refugees versus other status. So there are some of these questions that we could look more deeply into, and others that in our effort we were advised by all of our stakeholder partners to keep the survey as short as we possibly could in order to, you know, if our real goal was how many was one of the, you know, core foci of the survey, that we were really encouraged to keep it as short as possible in order to increase our response rate. And
of course, survey fatigue is a real issue with getting responses, so fully understandable dealing in the research field as well. And with that, we are going to jump into our wrap up of today's webinar. And while I get into that, are there any final points or comments that you would like to make, Paolo or Joan?
Just to thank you again to N4 for the opportunity to share these results out, and thank you to Paolo for sharing his experiences.
Yes, thank you, Dan. Thank you very much, Joan and Paolo, for taking the time to participate in today's discussion. And many thanks to you, the audience, for joining with us and engaging with us today. You're very much welcome to join us again for any of our upcoming webinars as well. And if you missed any part of today's presentation or would like to watch this session again, we will be posting the recording to the N4 platform within the next week. And we very much want to continue that dialogue that we've started today. So we'll be moving all questions that we didn't get a chance to address to N4's online moderated discussion forum called The Meeting Place. Along with that, we've invited our presenters to respond to your questions as well. We've also curated several resources, and thank you so much for sharing them with us, Joan. You can find these in our resource toolkit, and we will be linking them when we share the on-demand version of this discussion, as well as supplementary materials. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and learning opportunities. And along with that, following today's session, you'll be invited to complete a survey to share your feedback with N4. These surveys very much help us continuously improve and seek out new webinar content and opportunities that are responsive to the topics that you are very much interested in. We kindly ask that you follow the link and complete this brief survey, or you'll be directed to it after leaving the webinar itself. Along with that, we do have the ITP and IEN pathways that were developed back in December, available on the N4 website at newcomernavigation.ca/ITP-pathways, or the IEN pathways that are available through newcomernavigation.ca/IEN-pathway. We very much look to yourselves as well if you have any additional content that you would like to add to this through our IEHP resource hub on our website as well. And with that as well, check out our N4 mobile app. It's available on Apple and Android devices through the QR code here, or by going to newcomernavigation.ca/iOS or /Android. Thank you again very much. Thank you again, Joan and Paolo. We very much hope you can join us again at a future N4 event, and we hope that you stay safe and stay well, everybody. Take care.